So what are going to be our priorities when we are managing a wound? Well, as always, with any clinical procedure, our priorities are going to be A, B and C, often followed by D and E. So in the A&E situation, in the trauma situation, A stands for airway with C-spine control. That's established first. B is breathing with ventilation. C is circulation with hemorrhage control. D is disability, which is neurological examination. And E is exposure, environment, and everything else. So providing A and B are intact, we can go on to C. And in a wound, hemostasis becomes the issue. Now, I'm sure you've all heard about the concept of the golden hour. You've got an hour to stabilise your patients after major injury and major trauma. Another concept is the platinum first few minutes. So in major injuries, if there's a lot of bleeding, you've only actually got seconds or a minute or two to arrest that bleeding. So the first aid becomes massively important. And if there's a lot of bleeding, we need to apply direct pressure to the wound. Or if there's something horrible like a traumatic amputation, we want to use a tourniquet if we can't immediately ligate the bleeding vessels to try and prevent the hemorrhage. But even in a minor wound, hemostasis is quite important because it's hard to assess the wound unless we can actually visualize the wound to some extent. And normally hemostasis will be just achieved with direct pressure over the wound. Sometimes you might need to identify bleeding vessels, use artery clips to close them off and then tie them off with a ligature. So establishing hemostasis, usually the next priority. Some wounds, of course, you don't want to establish hemostasis. If a wound is dirty, like a human bite or a dog bite, or if you prick yourself with a dirty needle, there might not be a huge loss of blood. So actually in some wounds, we want to encourage bleeding because the blood can actually wash out any infecting viruses or bacteria. So we don't need to rush to establish hemostasis in all wounds. If they're infected, let them bleed a bit. The patient's not going to bleed to death if they lose a few tens of mils of blood. That's absolutely fine. So hemostasis. Then perhaps the next priority is anesthesia. Now often in minor injuries departments, A&E departments, we'll just infiltrate the edges of the wound with 1% lignocaine or 2% lignocaine. Sometimes we might be more sophisticated. For example, we might use a digital nerve block, injecting lignocaine to anaesthetize the digital nerves if we want to suture a finger or something. Of course, if you are putting anaesthetic into a finger, never put adrenaline in it as well. We don't want adrenaline in digits because it will constrict the blood vessels. And adrenaline and epinephrine, of course, are the same thing. So think about anaesthetizing the wound next. Then we need to assess the extent of the wound. The wound should be explored so we can know what tissues are damaged. We need to assess the wound. That's the next thing. And if the wound's dirty at all, we can irrigate it. We can clean the wound. So we take out splinters, we take out obvious foreign bodies. And probably the best thing to irrigate a wound with is large volumes of sterile saline. But where the tap water is relatively clean, or where the tap water is clean enough, you can irrigate minor wounds with just ordinary tap water. Washing out all the contaminants, washing out any dust or debris that's in the wound. So irrigating with sterile saline is a good idea. Sometimes in theatre we use a pulsed saline lavage and it sprays water in. You want a plastic protector around about it so you don't get it in your eyes, because it's very important not to get splashes from the wound into your eyes, because obviously that's got the patient's blood in it. So clean the wound, irrigate the wound as necessary. Then you're in the position to choose your healing method. And it's going to be primary intention, secondary intention, or sometimes you might elect to do a delayed primary closure. But it's going to be one of those. So if you elect for a delayed primary closure, you're going to instigate the treatments that are going to get the wound clean enough for a primary closure in a few days' time. If it's a wound healing by primary intention, you're simply going to close that wound. And if it's a wound healing by secondary intention, you're going to pack or otherwise cover that wound. So just a few things that you can think about in terms of priority of how we're going to deal with a wound procedurally.